Courtney, Priya just pinged me. She's running a few minutes late. So someone look out for her and let me know when she's joined. I think.
Yes, I will keep an eye out.
Good morning, everyone. We will get started in just a minute or so. Again, if per the chat, please change your Zoom name if you would for your country, name, organization, just so we can see where folks are. There's a huge number of registrants for this discussion today, and we want to also be able to reflect where folks are joining from. We'll get started in just a minute. If you have not yet done so, please change your Zoom name for country, name, organization, so we can see where everyone is from. And I think that with that, we have a critical mass. So we will get started. So welcome everyone from wherever you're joining us. Thank you so much for making the time today. I know we have colleagues joining across time zones across the globe, so thank you so much for your interest. I'm Carolyn Reynolds. I'm a co-founder of the Pandemic Action Network, and this is the first in a series of civil society consultations on the new Financial Intermediary Fund for Pandemic Prevention, Preparedness, and Response, lovingly referred to as the FIF, or fund, that's being established at the World Bank. On behalf of Pandemic Action Network and our consultation partners, CISDI from Indonesia, the Eastern Africa National Network of AIDS Service Organizations, EANNASO, and WACI Health, we're very pleased to have so many of you joining us today from so many countries, dozens of countries, in fact. And today's consultation follows and will, in fact, follow the same format as the one we had yesterday, which was held very early to reach partners across Asia. So first, we want to get to the discussion as quickly as possible, but first let me go over a little bit of background information, purpose and ground rules of this consultation, and then hand over to our moderator. So why are we here and where are we today? And if I could call up slide 2. We know there's a lot of interest in this new fund, a lot of unanswered questions. We also know, and we've learned from the establishment of other global financing initiatives, that meaningful civil society engagement, co-creation, and seats at the decision-making table are really critical to ensure that future investments will have maximum impact and drive better outcomes. So as a very brief recap, on June 30th, the World Bank's Executive Board approved the establishment of the FIF for Pandemic Prevention, Preparedness, and Response. This was based on many expert recommendations, including from this community, to establish this new type of financing mechanism, which is to address chronic underinvestment and close longstanding gaps in pandemic prevention and preparedness. These recs also were endorsed by the Independent Panel for Pandemic Preparedness Response and a G20 high-level panel on financing and many others, and was based on a consensus opinion of the G20. The purpose of the fund, the fifth, is to mobilize a dedicated stream of additional long-term funding to strengthen the capacity of low and middle income countries to prepare for pandemics. We have provided you with a lot of background information. We know it's a lot to digest as a pre-read, and I think we hopefully are putting the link in the chat. I asked my colleagues to do so. So if you haven't had a chance to read all of that, I would really encourage you to do so. Some materials provided, pulled together by the Pandemic Action Network, but also provided by the Interim Secretariat, jointly staffed by the World Bank and the World Health Organization. To date, about 1.25 billion has been pledged to the fund from 15 donors, 12 governments and 3 philanthropies, and others have indicated their intent to do so later this year. So since the beginning of July, the contributors to the fund so far have been meeting to design it, supported by this interim secretariat, as I mentioned, jointly staffed by WHO and World Bank. And they've been moving pretty rapidly to finalize the initial mechanics and setup of the fund to enable those pledges to be translated into commitments. And with a target date of mid-September for a first meeting of to launch the fifth. CSOs, for the most part, also other non-contributing stakeholders have not been in that room to help shape discussions and advance the decisions to date. And we know that the way things get started often embeds a structure that's hard to change, and we firmly believe that it's important to bring civil society voices into this equation now, into these conversations, again, to ensure that they benefit and that we and we are involved in the co-creation to ensure maximum impact. So that's why we're here. The purpose of these consultations is to start that process, to engage CSOs in the fifth design and also in operations, and we see this as the beginning of a process. So we're very pleased to have representatives from both the Interim Secretariat from WHO and World Bank joining us today, as well as a number of the contributing governments and philanthropies. They're in listening mode so that they can hear directly from you, your expertise and your perspectives to inform decisions that are on the table. So briefly, let me turn to Priya Basu, who is heading the Interim Secretariat for the World Bank, from the World Bank, to say a brief hello on their behalf. Priya, over to you.
Thank you very much, Carolyn. So on behalf of the Interim Secretariat for the fifth, I'd like to thank you, Carolyn, and the Pandemic Action Network for organizing this event together with the partners. We've been working with you over the past months, and very happy to have such an impressive turnout today. Equity and inclusiveness are critical principles underpinning the fifth. We've emphasized that right from the start. And so to that end, we really welcome these consultations and look forward to hearing from you, the civil society organizations present here, to hearing from you on how the fifth can, once and for all, help break the cycle of panic and neglect, and make sure that low-income countries and middle-income countries are better prepared for the next pandemic. While the primary purpose of today's meeting is for CSOs to interact directly, with the founding donors, who are the decision makers for this fund, the Interim Secretariat, of course, stands ready to help as needed. And I'm joined by my colleagues also from the WHO. As Carolyn mentioned, this Interim Secretariat is based at the World Bank, but we're working very closely with the WHO on this. So Scott and Bruce are here from the WHO, and I'm also joined here by my colleagues from the World Bank who are listening in, and also members of our legal and trustee team. So we really look forward to hearing from you, from the CSO community. And, we'll be in listening mode, but we're taking notes, and we'll make sure that, we reflect what we hear from you. We're still discussing the design and, the overall kind of governance and so on of the fifth. So things have not been cast in stone. So this is very well timed. Thanks again, and back to you, Carolyn.
Thanks so much, Priya, and thanks to you and the contributors for joining us today. So as you've heard, just the process is moving quickly. So it's important that we make the most of this opportunity today and to set the stage for continued engagement and involvement in this process going forward. So let me switch to slide 3 very quickly, some ground rules for us all to respect to make the most out of today. First, as you see, we're a very large group. We want to hear from as many people and as diverse mix of people as possible, but we do have time limitations. So just a few things first, and I think we shared some of this in advance already. Please update your Zoom name, country name, organization. Many of you have done that. Thank you. If you have not done so, that just allows us to see where folks are coming from. If you, your organization, some of you did participate in yesterday's session, we would respectfully ask that you stand back from taking the floor to allow others to have an opportunity to do so. And if you are not a civil society organization, we also respectfully ask that you don't take the floor. This is really meant for CSOs to a consultation for CSOs. If there are any media in the room, please do not attribute any comments made here today. We want to respect the nature of this consultation process, but we're happy to speak to you afterwards if you want to follow up with one of our Pandemic Action Network team members. Please raise your Zoom hand when our moderator opens the floor to make an intervention. And please stay on mute until you're called on. Please turn on your camera so we can see you and introduce yourself with name, country, organization. And please keep your interventions very brief, no more than 90 seconds so that we can get to everyone and one speaker per organization. We have set out guiding questions, which our moderator will work through. So please, if you can focus your interventions on those. And in the interest of diversity, the moderator may not exactly call on names in the order in which they come if in the interest of making sure we get a good representation. Just also adding, there's multiple ways we're capturing your feedback today. It's not just through your oral comments. The session is being recorded. We've got simultaneous interpretation in French and Spanish, which you can tag on the button on your screen. We also have a survey we'll be sharing where you can share written responses to the guiding questions and other questions you may have for the Secretariat or donors, which we will share with them afterwards. We have a Jamboard. We'll be taking notes live during the session and sharing some of those key messages in real time. And you can use the chat function, which I see some of you are already doing, to share and build on others' comments. And finally, we'll produce a summary of the feedback. So with all of that, let me please introduce our terrific partner, Rosemary Mburu, Executive Director of WACI Health, who's going to lead us through today's proceedings. Rosemary, over to you.
Thank you very much, Caroline, for the introduction. Good morning, good afternoon, dear colleagues and partners. It's my pleasure to co-facilitate this discussion. In addition to leading WACI Health, I'm also a co-lead on the communities and civil society forum to act together with GFAN and Stoppage. And so very happy to help moderate a discussion that brings the voices and perspectives and views of civil society to the table in such an important process. So I'll call up slide 4 in terms of how we have structured this discussion. It gives us an overview of our topics for today. We have 3 topics for discussions. We will be looking at discussion number 1, which is governing board. We will have 40 minutes for that. Looking at the composition, the selection process, and decision making. Discussion number 2 will focus on civil society and engagement. We will have about 30 minutes for that. And discussion number 3 will focus on technical advisory panel for 15 minutes. And I'm conscious that many of the colleagues on the line have other issues that we as communities and civil society would like to engage on. For example, including the scope, the priorities, implementing partners, and more. So today's discussion is designed to focus on informing the decisions that are moving the fastest, and that's why this focus on focusing on the decision point on governance. And as Caroline said, there will also be other future consultations that will also help us to focus on other topics of importance to us. Therefore, I think in terms of moving forward, we can go to topic number 1 for the first discussion on governance. This session will focus on the allocation of non-donor seats on the governance board of the fund, including the number, the proportion of seats, voting rights, selection process for the constituency seats, and decision-making protocols. There are 3 guiding questions for this. The first question is, what is the best practice board composition to appropriately balance perspectives and leadership from donors, non-donors, and community level stakeholders? The second guiding question is, what are examples of successful constituency-based governance structures and how do they operate in practice? How have these models been shaped by lessons learned, failures, and shifts in power dynamics? And the third question in this discussion is, what are concrete changes to the draft governance framework that can achieve these goals? So dear colleagues, feel free to speak to any of these guiding questions, and you're most welcome to take the floor and to air your perspectives and insights. So I would like to invite you to raise your hands or utilize the chat box in terms of making your submissions. And I will invite maybe 3 or 4 colleagues to come in first, and then we'll take another round of interventions. So we'll go with Paul Davis first, and then Haley, Peter Owiti, and then Samantha Rick. So we can take those 4 first. Over to you, Paul.
Hi, Rosemary. How are you? Nice to see you. Good. We're very excited. We at Right to Health Action, we're the largest grassroots network of COVID survivors and global health activists in the United States. We have fought very hard and long for a global pandemic fund against pandemics. We are very worried that while we are knocking on the door of a historic breakthrough, we're very worried that we are on the verge of setting fire to money in a dumpster. It's unacceptable to exclude low and middle income countries and indigenous communities disproportionately impacted from the design stage at the beginning. And it's unacceptable, and that's what almost everyone will say. It's also unacceptable to fund only other multilaterals instead of countries and communities directly. It's very curious to me how we ended up with a strategy or a policy at the bank that says that that rather than the ambitious $10 billion a year pandemic fund that we need funding people at the front lines, that we would instead be giving modest top-ups to other multilaterals that already have their oar in the water and COVID on their track record. If we want, the third point of 4 that I'll say is that if we want to really fund the gaps that are missing, we would be looking at funding something other than existing multilateral programs. And here's the last thing, and it's the biggest thing. It's unacceptable to only fund containment of outbreaks after a spillover. It's an expensive and disproven pathway that leaves millions of people dead, that is demonstrably ineffective. The most important thing perhaps is that it just accepts that poor people just die. If we're only working to build a wall around outbreaks that happen in poor countries to stop the spread of typically poor countries, to stop the spread from before it reaches wealthier countries, that's accepting that it's the same kind of orientation towards the world that allowed 20 million doses of vaccines to expire in the United States rather than going a long way towards eradicating monkeypox in West and Central Africa. If we want to have a global fund against pandemics that is successful and delivers results, then we should be incorporating from the beginning both the things that are on the table, which are primarily around IHR compliance and I guess classic preparedness measures, or containment is a shorthand that we've used. And in addition, also stops spillover, stops zoonotic spillover. We have a number of low-cost, cost-effective models that steeply reduce risk of spillover. And this is how we are also demonstrating that we value the lives of the poor, rather than only intervening after an outbreak has started. We would like to blow out the match rather than only sending fire trucks to a conflagration. Thank you very much. And
Thank you.
thanks for hosting the consultation.
Thank you, Paul. Haley?
Thank you for the opportunity. My name is Haley Severance. I'm Deputy Vice President of the NTI Bio team. Our thoughts are as follows. Civil society organizations should have a voting seat on the governing board and should have at least 2 seats. These organizations need to represent the full range of PPR capacities beyond the traditional scope of the initial implementers. For example, they should cover issues like biosafety and biosecurity in addition to the rest of the PPR capacities. As part of this, the board must ensure implementers also include organizations like regional organizations that really represent member state needs and should similarly seek to cover the full range of health security capacities. Starting financial qualification checks now for these diverse implementing organizations will help prevent stalling of progress. Decisions made by the board should be data-driven and linked to longer-term sustainment by national level governments. The board should consider commitments to sustainability as a condition for providing funding support, and this should be linked to a longer-term goal of really increasing domestic support for building and sustaining PPR capacity. Connected to this, the board will need to take a strong role in overseeing progress, monitoring accomplishments, and building off lessons learned. Civil society organizations can offer tools to help with this process, and we put forward the Global Health Security Index as one such tool. Thank you.
Thank you, Haley. Peter Owiti?
Yeah, thank you very much for this opportunity. My name is Peter Owiti, and I represent communities at the ACT-R. Now, my contribution is that the civil societies and communities have had a long struggle in fighting for space in most of these responses, pandemic responses, starting from the history of HIV. And now we have the FIF, which is also very good in the structure, except that the civil society and communities have not been guaranteed a seat at the decision-making board. And we know that the institution that is at the forefront, and that is the World Bank, historically is not very friendly to communities and to the civil society in terms of the history of their resuscitation role. They normally, it's a learning institution, both the Bretton Woods and that is IMF and the World Bank are normally not very friendly to communities because they normally put very stringent measures when countries are borrowing money, and in most cases it is poverty that drives the borrowing, and therefore that has not been very friendly to communities. Secondly, is that we have long history.
Thank you, Peter. Sorry, Peter. Peter, I'm sorry to cut your intervention, but your time is off, and given the number of people we have lined up, I'll just have to move on to the next person. Thank you so much for your inputs. Let's move to Samantha, please.
Hello. I
Thank
apologize for any background noise. I'm in a cafe, sorry. Wi-Fi was a problem. But I did want to say that the FIF must prioritize reaching and protecting the most marginalized groups and engaging in civil society organizations in the founding governance mechanisms and key decision-making processes. COVID-19 has had a disproportionate impact on those with limited access to health services, including adolescent girls and young women, LGBTQ+ groups, sex workers, and children. We cannot continue to worsen inequalities, and civil society and communities should be explicitly recognized as equal partners at every stage from conceptualization and design to implementation and governance of key pandemic preparedness and response decision-making mechanisms. To this end, civil society must hold no less than 3 seats of the governing board of the fifth, or 1/3 of the eventual number of seats. Thank you.
Thank you. So we'll take another round of 4. So I see Chris Collins, I see Caroline, David, and Sharonan. Over to you, Chris.
Hi, Rosemary. Thanks for doing this and for including me. I want to echo that I think the governance statements around the fifth need to emphasize the inclusion of multiple stakeholders and a commitment to equity. I agree a minimum of 3 civil society seats need to be included in the board, and there needs to be equal representation for implementing countries in the board. I also think the governance documents need to reflect a commitment to human rights-based programming, inclusion and attention to the needs of key populations, and a focus on building health systems that can be responsive today and are better able to identify and respond to new disease threats. I actually think there's a lot to be gained by building out from current programs that work, including the Global Fund. I know that the first tranche of funding, it sounds, will be identified for 10 specific countries. I hope that in the future, major investments can be made in the Global Fund and other programs and work through their own modalities, which already capture the inclusion of civil society in implementing countries in governance and the focus on human rights-based programming. Thank you very much.
Thank you, Chris, even for also giving us examples of models and also calling out some of the best practices in terms of number of seats. I'll hand it over to you, Caroline.
Thank you very much, Rosemary, and great to have this consultation. Just want to raise a couple of points. I am the diagnostic focal point for Access to COVID Tools Accelerator, and large disappointment at what is being proposed, not taking into account at this stage, the design stage, and not including at the design stage, the implementing governments and civil society. Because if we learn the lessons from ACTE, we can see that many of the failures that occurred there were because people were doing for rather than with. And we must, at this point in time, begin our design process. We can't be discussing design without the inclusion of civil society and implementer governments. And this would be a global public goods type of approach, which we should be modeling the Global Fund. I want to echo Chris on that. But I also want to say that whatever governance structure we develop must give equal voices to implementing governments, donor governments, and civil society. Otherwise, we will do what we did with ACTE, which is fail in large ways in different countries because we didn't have the voice of the country at the table when we were decision making. We must be decision makers. And Global Fund's governance structure, I obviously have very great faith in that balance, which allows different voices to shape policies, to shape programs, and to monitor programs. Thank you very much.
Thank you, Caroline. Thank you, just in time. So David, over to you.
Yeah, I'm David Bryden with the Frontline Health Workers Coalition. Thanks very much for the opportunity to provide comments on this. I want to echo the comments of some of the preceding speakers in terms of civil society representation on the governance governing body, in particular, at least 3 representatives of civil society. And I wanted to suggest that in order to be successful with pandemic preparedness and response, the operations of the fifth really need to take into account the expertise and perspectives of health professionals, in particular those on the front lines actually delivering medical countermeasures, vaccines, all the tools that are needed to respond to a pandemic. So that includes health professionals that are involved in the World Health Professions Alliance, the BOOST community of professionals who are involved in immunization, the nursing associations, the midwives associations, the community health worker associations. These organizations that need to be represented either directly or indirectly in the governance, because they have unique perspectives to bring to bear in terms of what needs to happen and what investments are appropriate to succeed with pandemic preparedness and response. And that really goes beyond what we've seen other structures engage in terms of civil society representation, such as the Global Fund or the consultations that PEPFAR engages in. So I think it's time to innovate and go beyond that in terms of civil society representation to include these health professionals associations in the governance of this new financing mechanism.
Thank you, David. Sharon Ann, over to you.
Hi. So in terms of the board, there should just be regions of represented by governments, regions that are represented by civil society equally. We should not be talking about dedicated set aside seats for donor governments. Of course, WHO, others should be observers at the board. Otherwise, I'm afraid that the FIF will suffer the same fate as many other agencies, where if there's a pay to play, where donors buy their seats in order to have their say, it will hurt the reputation, it'll hurt the performance, and it'll certainly hurt whether civil society stands alongside the FIF. I want the people on the call to please heed the lesson of Act A, because Act A did not listen to the pleas of civil society and governments for equal representation of LMIC governments. Because civil society was not a part of the initial design of Act A, you did not see civil society, including some of my colleagues on this call, promote the goals of Act A or mobilize for funding for Act A due to that low level of representation of governments from LMICs mainly. I agree with the other speakers that at least 1/3 of the seats on the board need to be for civil society. These should be done by regions. Not all civil society are the same, obviously. And although the question is about governance, obviously eligibility is inextricably linked, because if there was better governance in the setup of the FIF, then we wouldn't have to be making the case in 2022, for crying out loud, that entities in low and middle income countries must be eligible for funding. Thank you.
Thank you, Sharon Ann. A very strong call from many of the speakers here about learning the lessons from the past, building off from those lessons and taking that forward. Thank you very much, dear colleagues. So we'll take another set of 4. I see we have Pauline Irungu, we have Kurt, we have Asia and Robin. Over to
Thank you. Pauline Irungu from Perth, based in Kenya. So really quickly agreeing with colleagues that civil society needs seats, and those 3 seats are important. We should consider gender. We should also consider representation of young people. Also the issue of region, agreeing with Sharon Ann that it's important to have regional as well as LMICs. It's important, and a critical issue for civil society is to think about who will the civil society be accountable to. And that brings me to the point that the civil society themselves should be given the opportunity to select their representatives. There are lessons that can be drawn from the GFF, from Gavi, from UHC 2030, as well as Global Fund. And that means that when there is representation that based on the constituency selecting, there'll be accountability. In terms of looking at leadership or participation of LMIC governments, it's important that LMICs be included as at the governing body with voting rights, just like civil society, but also to think about at the level of the leadership of the FIF to have co-chair or co-leadership shared between donor governments as well as governments in LMICs. Thank you very much.
Thank you, Pauline. Over to you, Kurt.
Yeah, thank you, Rosemary. My name is Kurt Frieder. I'm from Argentina, president of Fundación Huésped, and member of the CSEM, and have been with the C20 for the last few years in different places. 2 things only. During the last few years, I've been hearing many times that even by the WHO Secretariat, that civil society has to have a bigger representation in any WHO governing board. And we have been demanding for 3 seats in that sense. not only in the decision making, but also in afterwards in the in doing the thing, in doing the project. This is the first thing. And the second one that I wanted to know, because I can't understand it, is why it is required to have another financing facility, knowing that the Global Fund has over 20 years experience and has been quite successful during these years. And we see that the raising of money for the fifth is not going well anyway. Thank you very much.
Thank you very much, Kurt. Over to you, Asia.
Thanks. Sorry,
Yeah.
I was having difficulty coming off of mute. Thank you so much. The additional points I will raise are very few, but building on Caroline's absolute frustration and really outrage that at this moment in time, we're having to debate equal, democratic, transparent, accountable representation from LMICs, from MICs, and from directly impacted communities. That's unacceptable. And the only thing I would add is that by September 30th, the first meeting of founding donors, those representatives, even if it's an interim form, should be at the table. We should not be announcing that it's possible. They should be there in real life at the table. Otherwise, the fifth will already face additional condemnation and criticism from around the world. So there are weekly design meetings excluding directly impacted communities and MICs. As Mike has said, that must change now, starting with the next design meeting. And by September 30th, representation, even if it's interim, should be there, equal at the table. Otherwise, the fifth will already face increased global critique. That way we get representation sorted so that we may debate equally, if not more important issues that representation hinges on, including eligibility, as Sharon Ann has mentioned, but also accountability of the bank. What exactly the scope and the prioritization of pandemic preparedness, prevention, and response interventions will be in the mix. David has talked about a few, so have others. There is no agreement from founding donors that those should be the ones that are prioritized. That's why we can't deal with these issues sequentially. They must be dealt with contemporaneously because they relate to one another. So let's ensure that governance is addressed by September 30th and put those other issues on the table now as well so that they can be resolved in favor of community demands. Thanks.
Thank you, Asia. Thank you. So we'll only take two more interventions, dear colleagues. We will then go into a wrap up of this session with a summary from my co-facilitator, Jessica Bell, but we'll take two more interventions. So Robin and Smita. Robin, over to you.
Thanks so much, Rosemary, and thanks so much for the opportunity to be here today. I guess just a couple of quick comments or observations, and I fully support everything that has just been said by my colleagues, in particular, Asia, Sherry Ann, Mike on the chat. The question that I really had is, so everything that we are hearing right now is not new, right? We have been feeding into this process from the very beginning. So it's a little redundant, and nonetheless important, but knowing that critical decisions are already being taken by the founding donors to the fifth is really concerning. So building on Asia's comments, Mike's comments in the chat, the idea of and definition currently of founding donors is heavily flawed, right? It's problematic because it really comes from the perspective of financial, disregarding all of the in-kind financial and other kinds of resources and contributions that civil society are currently making and have been making in the past. We've been contributing our knowledge, our time, our experiences. We need to be at those decision-making tables now. If the fifth is really serious about including and being inclusive and equitable in the decision-making process. So thanks very much.
Thank you. Smita?
Thank you for the So I agree with all of our colleagues' comments, and we definitely need effective representation from the CSO, and especially from the most marginalized groups like disabled persons, mental health, people with mental health issues, senior citizens, homeless people who are street dwellers, etc. And the key term is no one to be left behind, which is there in every document, like whether it is governance document or the government who is implementing. Whereas the most marginalized groups are not really, addressed. So even when we look at the World Bank project, there is just one statement saying most marginalized are included, or one photograph catering to a person with disabilities health. So that should not be the case. Every planning and every implementation should have a check asking whether most marginalized groups are included, and this should be part of the governance itself, and not on just tokenic representation, but effective representation. Thank you.
Thank you so much, colleagues, for the input, for the insights, perspectives. And so we want to wrap this up, and I'll invite Jessica to give us a summary of key takeaways from this conversation before we move into the second discussion. Smita, Jessica, over to you.
Thanks, Rosemary. And I greatly appreciate the robust activity, both in the chat, but also the folks who have raised their hand and added their comments today. Obviously, this is a CSO representative meeting to talk about the future FIP. On the line, we have over 220 participants, so there's a rich discussion both online and in the chat. Our goal, as Carolyn said at the very beginning, is to take this information, create a concise and cohesive story and set of recommendations to share with the Fifth Secretariat. So thank you. So with that, I have about 2 minutes to provide a bit of a summary based upon everything that we've heard thus far, again, both in the chat and the comments made. And I'd like to start with the changes to the framework, or rather looking at the board itself and how it needs to be shaped and who it needs to include. We've heard loud and clear that CSOs must be represented on this board and that they need to have a voting role. Part of that is also incorporating diversity in the CSO representation and having multiple seats on the board. For the board compensation itself, we've heard loud and clear that low and middle income countries need to be representative, and there needs to be a diversity towards that representation. Without having them on the board in the design phase as part of these crucial conversations leading up to the September launch, it's not going to put us on a charted path of inclusion and of equity. A number of you have raised great examples of best practices and models that we should follow, or perhaps that we shouldn't follow. One that really popped to attention was the lessons learned from Act A and other CSOs, as far as looking at what has worked as far as these newer avenues towards funding and what hasn't. The Global Fund offers a model for more inclusive governance and implementation. And loud and clear, again, we've heard the prioritization around those that are most marginalized. Taking what we've heard and we've seen and experienced with COVID-19, how do we prioritize those communities so that we're addressing really those at most of need? And lastly, I'll hit on inclusion, and I've touched on this a little bit thus far, but looking at ways in which we can incorporate both civil society, but also indigenous populations, again, in this design phase, and give an equal voice to the non-donor governments. Many of you have talked about the decision-making that's involved as part of this governance board and what's to drive that. And what we've heard is that it needs to be data-driven, that there is a feedback loop that is critical for this board, and that equity and inclusion are important. As we move to the next section where we're focusing on the civil society engagement, I'd love to hear more examples of how CSOs can specifically engage and the opportunities there to build and integrate CSOs within the process. So with that, Rosemary, I'll hand it back to you for our second discussion.
Yeah, thank you very much, Jessica, for that. And through a lot of, I think the discussion and the topics are quite intertwined, because when you talk about governance, you're also thinking about what do we mean when we talk about meaningful civil society engagement or meaningful engagement. And so that brings us to the second discussion, which is also very important in terms of the lessons we are learning, whether it's from the Act A or from the other global health governance structures, in terms of what exactly do different agencies or different frameworks mean when we say civil society engagement, and for one at that. So this particular session is going to address meaningful civil society engagement for the longer term outside of CSO inclusion in the governing body, including structure and cadence of meetings, transparency, and information sharing and accountability. Two guiding questions for this discussion. One is, what are examples of best practices of international bodies, financing mechanisms that successfully and meaningfully engage civil society? What are the critical elements of success? So we are looking for examples there. What are opportunities to build on and or integrate civil society engagement on the fund with existing mechanism? So we have 13 minutes for them. Please keep your comments to 90 seconds, because we will intervene and interrupt you if you're going beyond that. Thank you so much for observing that. So we'll follow the same pattern. I have 4 colleagues here. I will invite Jean-Francois. I'll go to Island Frontline Aids, Salam, and then Jacob. So I see you, Chris Collins, and I'll come back to you because we have colleagues who haven't spoken yet. Thank you. Jean-Francois.
My name is Jean-Francois Tardif. I'm with Results Canada. And I think we should have a chain of civil society participation. And it starts at the very bottom with having national action plans as a requirement for receiving any money from that fifth. And the national action plans for pandemic preparedness should have, in a compulsory manner, solid CSO engagement ingrained in them, with regular involvement guaranteed and monitored. So that's the first thing. So you're not even eligible to submit a proposal if you don't have that, like coordinating mechanisms you see with the GPE or the Global Fund. The second thing is the implementing entities that will be sending the funding to those countries should themselves have, as part of their governance structure, robust civil society participation in their governance. Otherwise, they shouldn't even be allowed to be implementing agencies. The third element is the proposals will be reviewed and monitored by a technical advisory panel. Again, the technical advisory panel should be reviewing civil society participation in the various mechanisms to make sure that at country level, their voices are heard. And we should have, of course, a civil society representative on the technical advisory panel checking that indeed civil society's voices will be heard and it won't be tokenism. So that's, I think, how we can have a chain of civil society engagement. Thanks.
Thank you. Thank you, Jen. Island from Frontline Aids. Sorry,
yeah, sure.
if I'm mixing the country.
No worries. Thanks very much.
All right.
Yes, thanks very much. Yeah, so I'm just calling in from Frontline Aids, which is based in the UK and South Africa. In terms of the guide questions for this discussion, which is looking at best practices of international bodies that successfully engage civil society. A few people have said this already, but we know the Global Fund, it's pre-existing fifth, which has been very successful in responding effectively against pandemics. You know, and this fund itself says that communities and civil society have played an active role at every level of their operations in terms of policy development, implementation, planning, the ED, Peter Sands, has said himself that, explicitly governments in the private sector, they have a key role in global health, but civil society is the oil and the engine that drive the success of the fund. So it would be important to build on the success of this type of FIF rather than, for example, the more recent pandemic emergency financing facility FIF, which didn't engage CSOs in its planning and implementation and setup, and experienced a lot of challenges and errors that the Global Fund has successfully been able to avoid and navigate. And then just on the second guide question, which is about opportunities to engage CSOs in the existing mechanisms, like a simple way to do this, just in terms of what's happening with the FIF now, to make sure that CSOs are engaged and invited in the weekly planning meetings, which are taking place between now and September to set up the FIF. And then again, just a very simple thing to engage them more in this process. It's been an extra challenge for civil society to engage in these discussions where English isn't their language of business. So I think if we want more engagement from global stakeholders, it'd be great to have documents and communications around the fund been more quickly translated into various languages. So yeah, thank you very much.
Thank you. Thank you. All right, we had queued up Salam. So Jacob Echoes, maybe you can.
Sure.
Jacob, you can hear me?
Yes, now I can hear you. Apologies. And I'll be brief with my comments. Thank you. I think just to emphasize that transparency is critical within this. It's important that we all know who is funded and through what implementer and for what priorities. It's important that those that are engaging civil society within this recognize that sustaining, monitoring, and helping with that implementation is critical to ensuring that we all of these operations and this implementation happens in coordinated fashion across regions and countries. This may be sensitive to countries submitting proposals, but a balance needs to be struck. Additionally, there needs to be regular communications with civil society from the FIF Secretariat itself. This will help in building a stronger feedback mechanism that will improve the FIF, looking at potentially like a 1-year check-in or 2 years, ensuring that over the lifetime of the FIF, there's engagement opportunities. And additionally, we need clarity on how civil society representatives will be selected throughout the lifetime of the FIF, that this is not just a one and done thing, it moves throughout the lifetime. Thank you.
Thank you very much, Jacob, for that. So I will invite another set of 4, just also recognizing that we have a variety of countries where we haven't had any interventions from. So I'll go for Cedric of GNP Plus from Netherlands. I see Lina from Canada as well. Then we have our colleague here from Switzerland, NCD Alliance, and Joan Cara, US. So Cedric, over to you. Thank you.
Thanks, Rosemary, and thanks everyone for this opportunity. I will actually just share two points. The first one is the principles of civil society engagement. We have been using the JIPA principle as a guiding principle for people living HIV involvement in decision-making process. And this has been working for a decade at the moment, proving the importance of engaging community in decision-making, but also in shaping programs and funding. The second point I would like to share is that we have lived this and during the COVID outbreak, the GNP Plus and other network of people living HIV conducted a survey to understand how people living HIV are being engaged. The key highlight that we got was that in many countries, people living HIV communities has been invited in National Emergencies Committee to respond to the COVID outbreak. This is an example that shows not only community are needed in terms of responding to pandemic, but also government and also donors need community for the same purpose. I would end my intervention by quoting UNAIDS, where in the report from the human rights on the human rights in time of COVID, They stated, engage affected community from the beginning in all response measures to build trust, ensure suitability and effectiveness, and to avoid indirect or unintended harm and ensure the frequent sharing of information. Thank you.
Thank you, Cedric, for bringing that to the room. Lena, over to you.
Very much. My name is Lena. I'm representing the Preventing Pandemics at the Source Coalition, which includes 18 leading organizations focused on health and environment. I just want to reiterate that this agenda focused solely on governance presupposes that everyone agrees on the scope of the fifth and that it should be containment only. But research shows that there are actions that can reduce the risk of spillover that are more effective, cost-effective than post-outbreak actions alone, and they're also more equitable. COVID-19 and now monkeypox have shown us the limitations of preparedness only. It struggles to overcome misinformation. We've also seen a lot of vaccine hoarding in the past 2 years. Focusing also on only stopping the spread and doing nothing to prevent the outbreak, it accepts the death, as Paul brilliantly said, of mostly Black people, Indigenous peoples, and people of color who live in emerging infectious disease hotspots. You also outlined in the background material for the consultations today that the fifth should address critical gaps, complement the work of existing organizations, and work across sectors. Spillover prevention is a critical gap. It's not addressed by any existing global health organizations, and it brings together multiple sectors. So it is a perfect fit for the fifth, and it must be reflected in its scope for it to be effective. Thank you.
Thank you. Thank you. So Tolulope? Yes, Tolulope, over to you.
Yes, good day, everyone. I'm Tolu from NCD Alliance here. So I wanted to just flag two things. And the first is that I'm really pleased that we are currently discussing how to ensure a meaningful engagement of civil society, not just at the regional, at the global level, but also at the national level. So I think it would be really helpful for us to already articulate as civil society what meaningful engagement would look like, both at the global level and at the regional level. We've mentioned the board seats, we've mentioned presence in meetings, we've mentioned, inclusion in assessment mechanisms. I think it would be helpful for us to have this clearly written, and so there's no debate about what we really want to see. And the second point I wanted to raise is that some of the things we're discussing around meaningful engagement is already reflected in the ongoing negotiations of the pandemic treaty itself. So I encourage us to look into the treaty and look for entry points that we can also include in our debates, or in our engagements going forward as civil society. If you look at one of the principles of the treaty, there's reference to national programs that recognize the marginalized. So these are already entry points where we can really highlight that community, civil society, and relevant stakeholders should be engaged in the ongoing discussions of the fifth. Thank you very much.
Thank you, Tolu. Joanne?
Yeah, thanks, Rosemary and colleagues. Just building on what folks said, I think the 3 civil society voting seats has to be the starting place. And as others have said, but to really be clear and reinforce that, those have to be chosen by civil society and communities. And also just with experience from other boards from the Global Fund, especially in this sort of startup phase, it is really critical that civil society is fully engaged and represented in committees that are going to be formed, because all of the questions we're raising around design, strategy, financing modalities, priorities are things still somewhat to be designed, and civil society has to have representation and voting representation in those committees. And I would just say, reiterating what other people have said, best model we have, hands down, is the Global Fund. And I think that that is about both at a global level in terms of that kind of governance, but also at country level, right? There has to be a critical role for civil society and communities at country level in developing and overseeing these plans, like the Global Fund, country coordinating mechanisms, again, not perfect, but the best model that we have for sign off by all partners. So I think that's really critical too. And also building civil society roles in there for kind of community-based monitoring, civil society monitoring programs to have that built into strategies, I think is also key. And it's going to help us build more equitable and holistic PPR strategies that actually advance primary health care, that tackle existing and new epidemics. Because I think otherwise we have a real danger of siloed projects which are not going to have impact and are not going to be equitable. And lastly, I would just say we do need resources to support civil society meaningful engagement. The meaningful engagement, voting engagement, a role is centrally what's key. But if we don't have the resources to support civil society to fully engage, then we're going to lose opportunities there. So thanks.
Yeah. Yeah, thank you so much, John. Very many critical points here from colleagues in terms of meaningful civil society engagement, how it has to be defined by civil society, even thinking about how do you select representatives to that, a civil society-led process, but also how do we capacitate and enable civil society to engage meaningfully through investments. Very well taken, and a lot of good stuff is also coming through the chat. It is all very well noted and much appreciated. I'll take another couple of comments. I see Maziko from Malawi, and then Michael, and then we can take Jamie. I think we can take those three and see how we are doing in terms of time. Over to you, Maziko.
Okay, thank you so much, Rosemary, and thank you so much, colleagues. I just want to agree to emphasize the point that civil society role in this regard is important, more especially COVID. We have learned that even at country level, if you don't have proper guidelines in terms of how engaging civil society becomes problematic. So at the global level, I think at the WHO health level, I think there should be a point where civil society voting rights in terms of decision making on this regard has to be well outlined. Like I think Joanna just mentioned that the Global Fund is very clear that if civil society hasn't made any voting rights in terms of making their proposals, that proposal is looked in a different way. So those could be some of the things which we need to push, make sure that civil society is on the table, but also we have a clear engagement framework which can be applied once we are trying to engage in those forums. So thank you much, Rosemary, for taking me up. Thank you. Bye-bye.
Thank you. Michael,
Thank you. Just echoing what everyone has said, but also just wanting to mention that we have an opportunity to do things differently. I think we should really be intentional and specific when it comes to CS selections. We have to be really making sure that people that are in room or CSO we're selecting are those that are non-homophobic and that respect the rights of women and girls and PLHIV. And I think also we should be specific in terms of how we define CSO engagement versus partnership. And also, like someone mentioned earlier on about transparency. So we should be able to also be specific who is getting money and for what. Thank you.
Thank you. Jamie, and if you've spoken, kindly put your hand down so we can identify colleagues who are still in the queue. Jamie?
Thanks, Rosemary. Just to say plus 1,000 to everything that's already been said. There's one existing mechanism I haven't heard raised yet, which is the Global Health Security Agenda. It's not a financing mechanism, obviously, but I think it's worth elevating the fact that they have a Global Health Security Agenda consortium for civil society organizations to participate meaningfully. They have their sleeves rolled up and they're doing the work side by side with countries. And I think that's an important example to elevate. They have, as was mentioned by results at the top of this feedback session, they work on country implementation plans. So they've got that perspective built in. And even when I look at the composition of their member state delegations and their participation, countries are often engaging CSOs to represent, sit alongside the ministries and engaging that work. So just wanted to flag them as another example of a mechanism that should be considered. Over.
Thank you for that. We can take another three. I see, Neil, you've had your hand up for quite a while. Then Catherine Sochil, as well as Tulika. Then we can come to you, Pauline. Neil.
Okay, thank you so much. My point is that we must engage CSOs with a diverse set of perspectives and expertise. All too often in the global health space, the focus is on pandemic preparedness with little attention to prevention, and it's imperative that the fund incorporate prevention. Pursuing the status quo incomplete strategy to pandemics focused only on preparedness carries fatal consequences, as we have seen with COVID and we are seeing again right now with monkeypox. The reality is that
como lo hemos visto con COVID y con monkeypox. La realidad es que los que entrenan
interventions to address the primary cause of infectious disease emergence, which is the spillover of pathogens from animals to people. This means that CSOs with expertise in environmental conservation, veterinary medicine, and wildlife biology be engaged. There are actions that can be taken, such as reducing deforestation and regulating commercial wildlife markets that can reduce risk of spillover. This is also an issue of equity, because it's clear that the tools of preparedness are inequitably distributed despite best efforts. We're seeing this with monkeypox, we've seen it with COVID, we'll see it again, sadly. In contrast, upstream prevention of spillover benefits people in some of the most resource-limited settings of the world. Furthermore, the actions to prevent spillover will help mitigate climate change, which is the greatest health threat that we face in the next century. So we have a narrow window of opportunity to implement changes, and it's imperative that CSOs, reflecting the diverse array of expertise, be engaged. Thank you.
Thank you, Nero. Catherine?
Thank you so much. And thank you for the great work thus far. I'm Catherine Michalova from EcoHealth Alliance. I think we have to be very realistic that the scope of the fund is quite large. And as Dr. Vora mentioned just previously, prevention of spillover looks very different than what's needed for preparedness, for response strengthening. And there are different stakeholders in each of those groups. The entry points are different. And at the country level and subnational level, the needs are very different too. So I think in terms of knowledge exchange and the role of expertise, we can really approach it with the relevant contributors for each of those areas: prevention, preparedness, response. I think we have to be very intentional that these do not get rolled up, because we know that the tendency is to go to response. So from a One Health standpoint, I think that has to be built in really to the governance mechanisms and then to the ways of engaging. I would say that these issues, of course, are very related to what we're seeing with climate change, with biodiversity loss. And there are very strong mechanisms through UNFCCC, through UNDRR, as well as through the Global Health Security Agenda Consortium. So for knowledge exchange, I think we should utilize those existing pathways. We've seen in the chat a lot about frontline staff and how we need to engage them. Absolutely agree. And also, not just human health workers, but humanitarian assistance workers, veterinarians, community animal health workers, eco champions, rangers, making sure they're really at the table in terms of the needs when we really get to the implementation phase. Thank you so much.
Thank you very much, Catherine. And indeed, quite a lot around frontline health workers. And I think a very important discussion when we go to the focus and priorities, especially on investing in health systems. So Sochil, over to you.
Hi, Rosemary. Hi, everyone. Thank you. My name is Sochi Sanchez. I'm a senior advisor and manager for the Secretariat of the Action Global Health Advocacy Partnership, composed of over 15 locally rooted independent organizations spanning 5 continents. I agree with a number of the contributions already made and want to emphasize that we need to ensure that the FIF can efficiently support the country and regional capacities needed to react to the next crisis and really fill a gap in the existing global health security ecosystem. We need to urge the FIF to uphold their own call to inclusivity, right, and ensure that civil society is included in the design stage immediately. I'm encouraged by the number of folks that have been sharing their thoughts. And we need to make sure that it does not, obviously become like an echo chamber, so that civil society engagement is tangible and meaningful. I think it's critical that implementing countries are at the table if we are truly to say that this is country-led, and that's something that I think we've heard multiple times from the World Bank, but that needs to come to fruition. We also need to ensure that affected communities and civil societies have a voting seat. The governance of the FID needs to recognize the essential contributions of civil societies and affected communities, bring beyond their observer role, and provide representation within the decision-making body. Also, just to reiterate what was already said, but I think with the FIF, we need to ensure that there's additionality, build on existing structures, and leverage the best practices and expertise, which often sits with civil society. And, we've talked about the Global Fund being one of the best examples on, how to really engage and include civil society. Also want to acknowledge that there are other mechanisms housed at the bank, including the GFF, that has done a better job, at least at the design stage, of being inclusive. And really the FIF should look to support versus duplicate the roles and capacity that, existing mechanisms provide, including civil society.
Thank you, Sochil. As I come to Lika, just to encourage colleagues who haven't spoken, especially colleagues from other countries where we haven't had any intervention, encouraging you to speak or put your comments and interventions in the chat. Over to you, Lika.
Thank you. Hi, all. I'm a scientist and a board member of Right to Health Action. A truly critical element of success for the fifth is the prevention of zoonotic spillover that protects vulnerable frontline communities at the source. This agenda assumes that there's global consensus that a fund against pandemic should focus entirely on containment and doesn't mention the need to prioritize spillover. My grandmother died in a crowded hospital in one of those frontline communities in India before vaccines were available. And even after vaccination, I myself am recovering from COVID infection last week. Our current approaches of solely focusing on containment after outbreak occurs are failing us. We have an opportunity to learn from this painful experience and do better. Containment only is not enough. Funding needs to go to prevent spillover, to stop outbreaks from happening in the first place. Our colleagues at Health and Harmony and others on the call have had first-hand experience of implementing a range of cost-effective interventions proven enormously to reduce the risk of zoonotic spillover. Let's focus there. True pandemic prevention and global health justice is stopping outbreaks from happening in the first place. Thank you.
Thank you very much, Tulika. So I see we have Pauline from Kenya. Again, we have Christian from Ecuador, and Cedric, your hand is up again. That's fine. I think you can come in. If colleagues who haven't spoken have comments, kindly you can raise your hand before we transition to the next discussion. Pauline?
Thank you so much, Rosemary, for this second opportunity. Really quick, agreeing with Joan Carter around resourcing civil society. And as we talk about resources, both financial, but at the fifth secretariat, to ensure that there is sufficient staff support that can lead civil society engagement and support civil society, including thinking through capacity development and all that civil society requires to function effectively. I think secondly is to think about the engagement structure for civil society to be enshrined in a clear framework that links over to the overall thinking behind the fifth, and that strategy to link not just at global level, but to also be connected to countries and the kind of plans that countries will develop. And as that planning process happens at national level, to have specific formal space for civil society to contribute and ensure that their ideas and thoughts are included in country actions. I think there are lessons around information sharing, access to the fifth governance that can be learned from both Global Fund as well as GFF. GFF has annual meetings, and alongside those annual meetings, there is a civil society workshop that civil society from different countries will participate in, allows for information for exchange, including with the funders and other players. And finally, as part of roles of civil society around advocacy, accountability, engagement of communities, as well as delivery of, outreach to communities that especially are far-flung, where sometimes governments never really reach, to ensure that those roles of civil society are included in the tracking mechanisms and they're reported on as critical components of the overall report of the FIF. Thank you very much. Over back to you.
Thank you, Pauline, also for highlighting the role and engagement of civil society also at the country level, which is very critical and important. Christian, over to you.
Buen día. Realmente es importante entender que las comunidades son una respuesta eficiente. Si es que desde el inicio las comunidades no están involucradas en los sistemas de dirección.
From the beginning, communities are not
in this part, which is the
especially in this
preparation.
part where it's the preparedness sector.
It's not going to be a good result, but it's very important.
It's very important
that they take this decision and that we can
start
creating
involving
social
civil societies
in this field. Thank you so much.
At the directive level. Thank you.
Thank you, Christian. Cedric, you can come in now. Oh, maybe that was a residual hand, Cedric.
Sorry, that was an old hand, legacy hand.
Okay. All right, no worries. Mocha, you can hear me?
Yes, and
Over
it's so
to
nice
you.
to see you. Yeah, nice to see you, Rosemary and everybody. I just want to raise a point which is not about civil society or even developing countries. It's just about where the money is going. I think Asia said that things are connected and we can't just say one thing and not the other. But anyway, the point I want to make is my worry is that funding health system or under whatever title they will put would mean surveillance, focus only on surveillance, and surveillance means like global surveillance, and maybe at a country level is kind of nice labs and trained people sitting in the capital, forgetting that the building blocks of any health information system and therefore of any surveillance is the trained and paid, well-paid community health worker and nurse who have the trust of the community. It's not because this is politically correct to say community health workers, it's because this is essential to get the real information about a disease or whatever. So funding these people at their sites in the community, continuously training them, linking them to local labs, not necessarily just go central, but to local labs, then to central labs. That would be essential for surveillance. Thank you.
Thank you very much, Moga. I think we'll turn to now a summary of takeaways. There has been a lot of input, very critical and important discussions and points. I'll turn to Jessica to see what the summary of our takeaways is. Over to you, Jessica.
Thanks, Rosemary. And in the interest of time, I'm going to be very brief in this summary, but I will start by saying that I love the caption at the very beginning, that the CSOs are the oil in the engine to drive success of this fund. And I might even offer a more climate-friendly alternative where the energy, the electricity to drive that battery. It's our collective workforce. It's the perspectives and the experiences and how we can mobilize successfully to address the gaps that you all have raised. The point about layers of civil society participation is incredibly important. It's not just within the governance board, which is incredibly important, but it's also the layers down to the country level and how those national action plans and the governance structure and the proposals are developed. Engaging CSOs and existing mechanisms within the planning meetings and the existing implementers is part of that. Accessibility. This is incredibly critical. When thinking about the verbal and the written communications, it needs to take into account multiple languages to bring in those diverse perspectives. And transparency, because of this, is really critical. So knowing who is funded, how, and through whom. And this lends itself to sustainment. So feedback with the Secretariat is going to be really important through this process. We've also heard that CSO involvement in committees is also necessary. So this is both within the design, but also in the post-design phase. And that consultation as part of the scope of the fifth with CSOs is important in understanding that future engagement. I'll end by saying that there was a number of points raised about the need to outline what meaningful engagement actually looks like. And this is both at the global, but also the national level. Now, some of the examples that were raised include the Global Health Security Agenda. This is a great example for coordination and country implementation. And then also the Global Fund, again, as an example of coordinating mechanisms that address both the primary healthcare as well as the broader pandemic preparedness and response. And most importantly, we've heard prevention, prevention, prevention. It cannot just be containment. I realize we only have a few minutes to tackle the technical advisory panel. So Rosemary, I'll hand it back to you to address those questions. And thanks everyone for your input. There definitely are some linkages across all these conversations. So appreciate the new views.
Yeah, thank you very much for the summary. It's very helpful to wrap it up like that and to hear what the key takeaways are. So we'll turn to the last discussion, not so much time for that, but in the time we have, we will address the shape and function of FIF's technical advisory panel, including its composition, its mandate, and interactions with the governing board and civil society. To guide us for this question, topic, we have two guiding questions. What kind of competencies and perspectives are required in the technical advisory panel? What should be the role of civil society, NGOs, and other community level experts? How should WHO's technical expertise be leveraged in fund governance and decision making? So this, we have about 10 or less minutes to discuss. And so let's go for it. Let's open the floor. I see Elon, you are there, Ellie, and Daniel. So we start with you, Elon.
Yeah, I'll jump right in. In terms of the advisory panels, I think it would be really important if CSOs and community networks that have been involved in pandemic response against HIV and more recently COVID and monkeypox, they need to be invited into the advisory panels as technical experts rather than just observers. I think that's one of the key learnings from the HIV response the last 40 years, that these types of community organizations have specific expertise and skill that are distinct from other stakeholders, but still are a key plank in successful pandemic responses. In terms of the second guide question about how the WHO's technical expertise should be leveraged, I mean, the WHO has a wide range of technical expertise, but in the context of this meeting, within their programming around HIV/AIDS, they have quite strong capacity in terms of collaborating and engaging with civil society. And they've recently been able to transfer and utilize that quite quickly and effectively in the monkeypox response. So it'd be great if they could also leverage that type of expertise and collaborative experience into efforts around the future pandemics and this fifth as well. Thank you very much.
Thank you very much for that. Ellie, to you.
Great, thank you very much for the floor. So we need to make sure that the competencies and perspectives from the animal health sector are included in this technical advisory panel and throughout the governance structure more generally. So there are huge weaknesses in the animal health system and the animal health workforce globally that need to be addressed by this fund to prevent the spillover of zoonotic disease, like we've heard already. So just to give you a flavour, there's an estimated 2 vets per 100,000 people in some parts of Africa, compared with 2 vets per 1,000 people in a country like Spain. So animal health workers at the community level and beyond are vital in the detection, prevention and treatment of zoonotic diseases, both in wildlife and domestic animals, and also in preventing antimicrobial resistance. So when the World Bank fifth proposals talk about the health workforce and specialist health expertise, this should also include the animal health workforce as frontline workers to address zoonotic disease spillover at source. Thank you.
Thank you. Allow me to invite, before I come to you, David, to invite Sylvia from Kanko in Kenya. Just, we haven't heard from you, and then if they say, we'll turn to you, David. Sylvia, over to you.
Thank you, Rosemary. So I wanted to speak to the constitution of the technical team, I feel, and I believe that the CSO, the community, they still remain an important person to be in this table. So I would say that in the constitution, all the way from the international level to the country level, we should ensure that a third of that composition is actually given to the community and CSOs for them to nominate their representatives.
Right, thank you so much. Thank you, Sylvia, for that. Daniel, over to you. Sorry, I confused with David. Daniel.
Thank you, Rosemary. And very quickly, just a couple of thoughts, I think, to answer both of the questions about how to input on the technical side. And I think in relation also to the previous section, I think it's important for us also civil society not to, or perhaps manage in the best way the duplication in our mandates, right? And being able to leverage in the best way possible our connections with social movements, for instance, something that is clear for my organization in particular, in the connections with the social movements that we have across the globe, and with community health workers. I think it will be important that we clarify what are the areas of expertise and kind of like the connection, not only for the representation aspect of being sitting around the table, but also for being able to provide evidence and really profit from the experience and data that we can collect as civil society, international civil society, and just to make sure to convey the message of really balance the representation from north to south. Specifically, I think one interesting example is really looking at this call and how are we represented here. And my final point really to that technical aspect will have to do also with the way that the implementation is proposed through the UN system really in country. And I want to make sure that it's also conveyed the message that many of our organizations, right, have such vast mandates and are present in so many countries that we could also have or be helpful at that country level that can leverage the connections between government, civil society, UN system, and the very grassroots level, or with social movements, of course, securing that information, that data, that richness in the perspectives are reflected in what it's decided over.
Thank you, Daniel. Let's take maybe Nigeria. Femi, I see you. You can come in.
Yeah. Thank you, Rosemary. My take is that for the technical committee, it should be more of a cross-edging. What I meant is this: that there should be expertise from the health sector, from the animal expertise, financial experts, for us to have a balance. Can you hear me? Can you hear me?
Yep, yes, we can hear you.
Yes. So for us to have a balance, I mean, it should be composed of expertise from the health sector, from the financial sector, and perhaps those who have some very good expertise too in budget monitoring. So and also the composition. Well, the CSOs have a lot of roles to play, and of course, the community levels to have a lot of roles to play. And what roles do we play as CSOs, as usual, for quality assurance, as a watchdog, and as an agent too for change? Okay, thank you very much.
Thank you. I'm looking for colleagues who haven't had the chance to speak, so I'll go to Arush.
Thank you so much, Rosemary, and thanks, colleagues. So I have three specific recommendations for the technical advisory group. The first is the targeted engagement of experts outside traditional health security capacities. I know colleagues have mentioned key groups, but I think one that many people have not discussed is social scientists and behavioral scientists, as well as folks that are experts at primary healthcare. I think these are two areas in terms of expertise that sometimes gets overlooked when you're looking at traditional health security capacities, but we very much know with COVID-19, these are key gaps. And in additional to this is also vulnerable populations such as women and girls, refugees, people with varying socioeconomic backgrounds. The second recommendation is that the technical advisory group should clearly link to other PPR mechanisms. I'm concerned right now that with the way that the FIF is going, that we are not clearly linking up with what will be happening with what the key gaps that are decided by member states with INB, with the WGIHR, and we need to be complementary of all the preparedness needs that are exposed by these processes, as well as what's also discussed during the UHC high-level meeting in 2023 in terms of preparedness and infectious disease control. And finally, linked to this, the technical advisory group should be linked with the governing board in terms of operationalization. One thing that we saw that worked actually well with Act A was that the pillar leads were both doing some of the governing as well as the operationalization. And that was really helpful because you were able to link up technical needs in real time with decision-making of where funding should go. And that's an important need that should be also addressed through the FIF, is that the technical advisory group can clearly regularly advise on where money should be going, and that too the governing bodies regularly updated by the technical capacities. Great, thanks, I'll stop there.
Thank you so much, dear colleagues. And I think that's all we are able to take in the interest of time. And so for Jessica, I think we'll invite a colleague to project the summary of this particular session. And I'll also be handing over to Caroline, who will be leading us in the closing session. Thank you very much, dear colleagues, for your input and for the discussions. Sorry we couldn't take all the comments, but they will all be captured. Over to you, Caroline.
Thanks so much, Rosemary. Thank you to you for expert moderating. I know it's challenging with so many people on the line. Thanks, Jessica, for the terrific quick summaries. And to my colleague, Courtney Carson, who's behind the scenes curating the Jamboard, and also actually to all our PAN staff who helped pull this together and our convening partners. And most of all, to all of you for taking the time to participate in such rich comments in the chat, in the oral interventions. As we said, this is the beginning, not the end of what we hope will be a very robust engagement for civil society and involvement in the fifth, in both this design, but also in the governance and operations going forward. I can't possibly give due diligence to all the rich stuff today, but we did hear very strong and consistent messages about equity, about inclusion, about diversity, the role of CSOs, specific recommendations on the number of seats on the board, the importance of that also reflecting the involvement and involving communities, and equal representation for low and middle income countries, the diversity, both in terms of geography, but also in terms of skills and perspectives, is very important across both the governing board in terms of the type of work the fifth is going to support, and in terms of group. Very important messages on feedback loop and communications and engagement, and the resources that are needed, as well as the time that is needed to commit to that. And I think that's a really important message for the contributors and for the interim secretariat to hear. And we have lots of best practices for all of this across what has worked in other financing mechanisms, from governance and from civil society engagement and from these types of advisory panels that should be built on in designing this fifth. Also important message, it's about data-driven and the importance of data driving what this fifth investment invests in, but also on the scope, and that the scope, very importantly, strong messages that it's not just about containing pandemics, but it's about preventing them before they start. So that's just a little bit of the reflections. Again, we are producing a summary of the messages that we heard today. We will capture what's in the chat. We have, I hope my colleagues have posted the survey, which is an opportunity for you to provide written comments, as well as to ask any questions. We will gather all of that together and share that expediently with the contributors and the interim secretary to inform their process. We hope this paves the way for a really meaningful engagement process over the long term, and co-creation and leadership for CSOs in the design and governance process. Please plan to join us. We're going to, this is, as I said, the first of a series in 2 weeks' time on August 30th and 31st at these same time zones. We will have a next round of consultations together with our convening partners. We'll come back to you on the agenda for that, but look out for that announcement and the opportunity to join. So again, thank you for your rich participation, and have a great day wherever you are. And that concludes the session.
Thank you. Thank you very much.
Thanks, everyone.
Thank you.
Thank you.
Thank you so
much. It's been a pleasure being a part of this.
Gracias.
Thank you so much.